Welcome, everyone, to the Point, presented by SSM Health Monroe Clinic Medical Group. I'm Kent McConnell, and I'm together today with Shauna MacKenzie, PharmD, part of the Pharmacotherapy department at Monroe Clinic. And welcome, Shauna.
Hi, Kent. Thanks. Great to be here today.
Would you please give our listeners some information about yourself, such as a little bit of background and perhaps what made you want to go into medicine?
Sure. So I'm originally from Ashland, Wisconsin, at the top of the state. I came down to the Madison area about 8 years ago to do some college and then pharmacy school afterwards. Growing up, my mom was a nurse, so there was always a focus on health in our household, which is why I originally became interested in the medical field. As I went through high school, I found I really enjoyed chemistry, which first prompted me to consider pharmacy as a career path. And then I was able to shadow a few pharmacists prior to college and throughout, and I was further drawn to the profession due to the wide array of practice settings available, continuous opportunities for learning, as well as a dedication to ensuring best patient care.
If you wouldn't mind explaining to us as well, Shauna, what exactly is pharmacotherapy?
Pharmacotherapy and a pharmacotherapist is a type of pharmacist who specializes in the management of medications used for chronic disease states. So as pharmacists, pharmacotherapists know details about medications other clinicians can sometimes be unaware of. This includes detailed information about how medications act in the body, expected medication side effects, and how medications interact with one another. Pharmacotherapists are also more familiar with the cost of medications. They often know of cheaper and equally effective medication options, as well as tools to help patients reduce medication costs.
Shauna, today we're taking some time to learn about COPD. To start, would you please explain what COPD stands for and perhaps a little bit more about it?
Sure. So COPD stands for chronic obstructive pulmonary disease, and COPD is a type of lung disease that occurs when there is damage to the structure of your lungs. So this damage is usually a result of long-term exposure to an inhaled irritant, such as cigarette smoke, for example. Once the damage from the irritant occurs, it tends to be irreversible. Both chronic bronchitis and emphysema are common forms of COPD.
What are some of the risk factors and symptoms of COPD?
The biggest risk factor for COPD is smoking. Cigarette smoking is the cause of about 90% of all COPD cases. Other risk factors include exposure to toxins in our environment. So examples of this can include long-term exposure to air pollution, secondhand cigarette smoke, as well as exposure to chemicals such as asbestos. The most common COPD symptoms include shortness of breath with activities of daily living, such as getting dressed, for example. Other symptoms include chronic wheezing, recurrent or frequent lung infections such as bronchitis, and a persistent productive cough. And when I say productive, I mean the cough produces a lot of mucus or phlegm.
We're visiting today with Shauna MacKenzie, PharmD at SSM Health Monroe Clinic Medical Group. And Shauna, how does COPD impact patients' lives?
Without treatment, COPD can pretty greatly reduce one's quality of life. So it can be difficult for people with COPD to do things as simple as taking their dog for a walk down the block or things of daily life such as getting dressed, brushing teeth, just walking around the house. Having COPD can also make people more likely to have long-lasting negative effects from other infections such as COVID-19, influenza, pneumonias, and even the typical viral seasonal cold. Fortunately, though, there's treatment that is available to make COPD symptoms more manageable, and there's vaccines available to help protect people with COPD from developing complications from other illnesses.
Well, you mentioned that there are treatments available. Could you perhaps mention to us what treatment options are available for those with COPD that may go beyond vaccines?
Sure. So fortunately, there's a good amount of different medications available. COPD is usually treated with a variety of medications that are administered via inhalers or sometimes nebulizer devices. A nebulizer device, for those who have never heard of that, it's a machine that turns a liquid medication into a particle that you can then breathe in. Typically, someone with COPD will have one or more medications that act to open up the airways and then also decrease inflammation in the lungs over time. There's both long-acting and short-acting forms of these medications. The long-acting forms are taken once or twice daily, usually, and then the short-acting ones are usually reserved for when the person is actively having a difficult time breathing, which hopefully is not occurring very often if they have good, adequate long-term control. Examples of long-term acting agents include Ceravent and Spiriva, and short-acting examples include albuterol and ipratropium or Atrovent. And then sometimes they'll use inhaled corticosteroids as well, which act similarly in that they help reduce inflammation over time.
Now, if someone is diagnosed with COPD, Shawna, does it always get worse or can it somewhat stabilize?
COPD does not always get worse if it's adequately treated. However, unfortunately, once the damage to the lungs occurs, it's usually irreversible. So, with that being said, I do want to emphasize that while we have medications available to quote-unquote treat COPD, like I said, it's never going to reverse the structural damage, and if anything, it will just help to stabilize symptoms. The one thing I do want to mention is that the number one COPD treatment is to quit smoking. Continuing to smoke once you have COPD will only continue to worsen the disease.
Now, how can a pharmacotherapist such as yourself help with the management of COPD?
Sure. So, like I kind of said previously, a pharmacotherapist, we tend to deal with chronic disease states such as COPD. And due to our background as pharmacists, like mentioned, we are highly trained in the intricacies of different medicines. So we can help simplify regimens, help optimize the current regimens that people are on for their COPD, help decrease costs related to their COPD medications, and also help with things like adherence, because a lot of times when people have COPD, they are on a lot of different inhalers and nebulizer solutions, etc. So having a pharmacotherapist there as someone who is formally trained in the side effects of medications and all the different things that come along with medicines, it really helps to simplify things for patients, make sure that they're getting the best benefit out of the fewest medications possible.
Now, if our listeners would like to schedule an appointment with the pharmacotherapy team at SSM Health Monroe Clinic Medical Group, how can they go about doing that?
So if interested in seeing one of our pharmacotherapists at the Monroe Clinic, patients can call 608-324-2259 and ask to speak with one of our staff to schedule an appointment. They can also contact their primary care provider and have their provider refer them to us as well.
We've been visiting today with Shauna MacKenzie, PharmD, part of the pharmacotherapy department at Monroe Clinic. And Shawna, thank you for being with us today.
Thank you, Kent. I really enjoyed my time talking about COPD today.
For Shauna MacKenzie, I'm Kent McConnell, and this has been To The Point, presented by SSM Health Monroe Clinic Medical Group.